In Quebec's latest budget, funding for the infrastructure plan was raised to $164 billion over the next decade, a 7% increase, mainly to counter Trump's tariffs. However, there has been a lot of pushback over which projects are still part of the plan and which ones were put on pause or abandoned.
Monsieur le maire, ça va bien?
One of those delayed projects is the reorganization of the access points to the bridges in Quebec City. Premier Legault made it one of his priorities after he took power back in 2018.
Je suis déçu qu'on ne soit pas capable de planifier toute la lutte à la congestion qui est nécessaire à faire pour que tous les citoyens de Québec puissent circuler fluidement.
In Montreal, people are protesting in front of FACE. The Legault government is scrapping the renovation project of the heritage building of this public school and plans to sell it.
Unfortunately, the price tag makes it impossible to continue with the current model.
The opposition at the National Assembly won't let this fade away.
Today, they're unable to deliver these projects, and this is everywhere in all the regions of Quebec. So today, when they do announcements, we don't even know if these announcements are going to give anything, if there's going to be a project at the end of the day.
While a lot of people talk about what's not in the infrastructure plan, I encourage people to take an open mind and look at what's in the plan.
The Maisonneuve-Rosemont Hospital is in the province's infrastructure plan, but it's stuck in the planning stage. Even though people living in the eastern part of Montreal clearly need a new facility.
C'est une très, très bonne nouvelle qu'on annonce aujourd'hui.
The Health Minister Christian Dubé announced the modernization of Maisonneuve-Rosemont's hospital twice.
Les travaux préparatoires peuvent commencer aussi.
The construction work was supposed to start in 2024, then in 2025, and now not before 2026.
We have now Santé Québec that look at it on a global way. They have a full budget on infrastructure of $3.6 billion. We think they can find a solution.
Fait qu'à défaut de livrer l'hôpital Maisonneuve-Rosemont,
Vincent Marissal is the M&A for Rosemont. He's been pushing for a new hospital for years.
they are mad. They are really mad right now in Eastern Montreal about this really, really bad decision.
No, I think it's a major issue.
For this political analyst, citizens' trust is at stake. Maisonneuve-Rosemont's hospital combines the CEQ government's promises to improve public health services and infrastructure.
I think it hurts its credibility. People start comparing that to the third link, which of course has been a big issue for the Legault government. So I think that this might become a symbol. At least that's what the opposition parties would like it to be.
The CEQ has always struggled to win seats in Montreal. A difficult second mandate and the lack of good news on infrastructure projects that the Legault government promised may have political consequences.